Hello, this is the narrated overview of the PowerPoints for HIT 154 for the nervous system, special senses, illnesses, and mental illness section. I am your instructor, Alice Shapiro. This will be an overview, and a very important factor for this study of this unit are the short videos that are on your Moodle site. There should be active links. There are active links. Let me know if you have problems accessing any of these, and some additional information I have about some of these selected diseases and conditions. Objectives I have for you are listed here. Again, basic terminology. Hopefully some of this is familiar to you from medical terminology and other classes you've had. I want you to be able to describe the key characteristics of the selected diseases of the nervous system and special senses, understand the etiology, signs, symptoms, diagnostic tests, and possible treatments for the diseases that are selected here, and describe the warning signs of mental illness, identify signs, symptoms, etiology, and treatment of substance use disorders, eating disorders, and autism, describe diagnostic approaches for mental illness, and identify the warning signs of suicide, which are listed in your text. Here are some of the diagnostic procedures. Cerebrospinal fluid can be examined via a spinal tap. Angiography allows us to visualize cerebral circulation. Computed tomography helps in diagnosing conditions such as tumors, hemorrhages, hematomas, and hydrocephalus. Electromyelography allows us to view the spinal cord. Myelography is used to identify spinal lesions, and that could be caused by trauma or such diseases as ALS. EEGs record the electrical activity of the brain. This can also tell us if there are lesions or tumors, seizures, or impaired consciousness. MRIs can be used in conjunction with other computer views to record tissue characteristics, and then we can look in different planes of the brain or spinal cord. Here are some disorders of the nervous system: headaches, migraines, infections, seizures, errors in fetal development, which can lead to birth defects, of course, trauma. And many of these manifest themselves in abnormal muscular activity, obviously, since the nervous system controls skeletal muscle activity. Alzheimer's disease, and actually we're going to see it mentioned here twice in this PowerPoint, because it's both a disease of the nervous system and manifests itself also as a mental disorder. It is the most common cause of dementia in the elderly. It is on the rise. Most individuals who develop this disease, the vast majority, are past the age of 85. We don't know the root cause, although there appear to be some genetic components. The only way to absolutely confirm someone has Alzheimer's is in autopsy. Then we can view the plaque in the brain. But family history and behavior and so forth gives accurate diagnosis in about 80 to 90% of the cases. Unfortunately, a person tends to die within 5 to 10 years. Multiple sclerosis is a chronic progressive disorder of unknown origin. There is more and more evidence that this is an autoimmune disease, but again, why an individual develops an autoimmune disease in many cases is not clear. So these are some of the ideas. The symptoms: as you can see, muscle impairment, loss of balance, poor coordination, difficulty in speaking, urinary bladder dysfunction, double vision, lesions in the optic nerve, possible blindness, nystagmus, which, as you may remember, is the lack of ability to control the extrinsic muscles of the eye, so it may be cross eyes or just gazing off in different directions. Usually affects young adults between the ages of 20 and 40. It is difficult to diagnose in the early stages. There are stages of remission, and then stages of more rapid disability from the disease. What is involved in this disease is the degeneration and inflammation of the myelin sheaths. And if you don't recall what the myelin sheath function is, you may want to look if you still have an anatomy physiology text or look in your medical dictionary. Those are the insulating structures either produced by Schwann cells or oligodendrocytes that insulate the axons and nerve tracts, nerve fibers, and allow more rapid transmission of the nerve impulse. And as this says here, it does protect the neuron, actually the axon of the neuron. So when this degenerates, it impairs nerve conduction. There is no cure. There are some treatments that are listed here. Another condition is Parkinson's disease, which is a movement disorder that results from degeneration of nerve cells of the basal ganglia in the brain. The affected neurotransmitter is dopamine, and you can see the list of symptoms. The cause is unknown. It may be environmental factors, perhaps undetected viruses, perhaps environmental pollutants, toxins. We don't know yet. Treatment, medications that increase dopamine, L-DOPA, although unfortunately there is a dose response and you cannot increase the dose effectively enough to continue treatment of this disease. And therefore the disease does progress in spite of treatment because you cannot give enough L-DOPA. It becomes less and less effective. Here's a summary of what occurs and what the symptoms are of this disease. Other conditions are TIAs, which means transient ischemic attacks. And if you recall, hopefully, ischemia is the lack of blood flow. So again, recalling that blood brings oxygen to the tissues, you can see that brief blood flow, or brief, I should say, interruption of blood flow in a cerebral artery could cause severe damage. It may be due to atherosclerotic narrowing of a blood vessel or embolisms, which temporarily lodge, and the attacks last for just a short time really, or up to several hours. The average attack lasts about 15 minutes. My mother did suffer from TIAs and did finally succumb to a stroke at the age of almost 92, just a few weeks short of her 92nd birthday. And her, what happened to her when she had a TIA quite often was that she would faint. So the manifestation is often abrupt, and here are some of the things that can occur. Lips and tongue may become numb, causing slurred speech. Her speech was slurred for a time after she recovered from her fainting episodes, but most of her symptoms were fainting episodes. They often, as for the case of my mother, do precede a complete stroke and often serve as warnings of cerebrovascular disturbance. It goes without saying that if you or any loved ones or patients or clients are suffering from TIAs, get them diagnosed quickly. Cataracts, the lens of the eye becomes cloudy. When throughout our lives the lens enlarges about 4 times and becomes thicker and heavier. The actual cause of cataracts conditions might not be known, but probably either congenital, traumatic, something toxic that affected the lens, or just the degeneration or senility of the lens. And we'll take a look at what cataracts, what a person who is suffering from cataracts might visualize. This is what happens. The whole image is blurry, and people report the dulling of colors. I've known people who've had cataract surgery and they said, oh, I forgot how bright colors could be. So you can imagine walking around with this kind of a view. Macular degeneration is a different disease of the eye. It causes loss of what we call central vision. Again, if you recall, the macula lutea and fovea centralis in the retina of the eye are the areas of most acute vision. This contains the cones, most of the cones and only cones, and is our most sharp vision. We don't really know the exact cause, but it is from degeneration or extravascularization in that area. And let me just show you in a moment. You can read about these before. There are two types. I'm not going to really worry about you remembering the two types, but I do want you to understand this is what it would look like. Again, central vision, because of the lack of functioning, we could say the death of the most acute photoreceptors in the macula lutea, the cones. Otitis media. Otitis is a swelling of the ear, and in this case it would be the middle ear. It can be precipitated by upper respiratory infections. Bacteria are the common agents responsible, and if it is left unchecked, perforation of the tympanic membrane or the eardrum can occur. Untreated mastitis, or I should say mastoiditis, or inflammation of the mastoid process, is a risk for brain infections and abscess formation. So it can lead to infection of the nearby mastoid process, so it should be treated, definitely. All right, I think I'm going to stop here because our time is running short, and I will pick up another YouTube and cover the rest, the mental illness sections of this PowerPoint.